Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I would like to demonstrate the self-myofascial release technique for the suboccipital muscles. The suboccipital muscles are short muscles that attach to the back of the base of the head. When they contract, they lead to extension of the head on the cervical spine. When dysfunctional, the suboccipital muscles can help contribute to that forward head posture with the protractors of the shoulder and the internal rotators of the upper arm, which can help to lead to thoracic outlet syndrome, again, which is that numbness, tingling, burning sensation that runs down the shoulder, the arm, and into the hand, and also tension headaches that start or originate around the suboccipital muscles and travel laterally and forward towards the temple of the head. For today's technique, you are either going to need a lacrosse ball or a PVC pipe or a foam roller. For the foam roller or PVC pipe technique, I'm going to lay with the roller perpendicular to the cervical spine, at the very top of the cervical spine and at the very bottom of the head where the suboccipital muscles attach. I'm going to rotate the head in both directions, from right to left and from left to right, looking for tender points or areas that I can feel tension. When I find these points or areas, I'm going to allow gravity to push the head and neck into the roller, providing the ischemic compression into the trigger point for at least 20 to 30 seconds. Then I'm going to search for 2 to 3 more points, and again, if I can compress and apply ischemic compression to 2 to 3 points, I'll have achieved the myofascial release component of this technique by having direct pressure into the fascia near the top of the cervical spine and the base of the head for approximately 1 to 2 minutes. So for the lacrosse ball technique, I'm going to take the lacrosse ball and I'm going to place it in the same area, starting closer to the middle of the cervical spine, or that first vertebrae at the top. And I'm going to have to move the ball with my hand laterally to locate those areas of tenderness or tension. You may have to rotate the head and neck slightly to pinpoint those areas with the ball. Again, once you find them, you want to compress them for 20 to 30 seconds. And you want to find at least 2 to 3 of these trigger points and deactivate them. If you can deactivate, again, 2 to 3 or even 4 of the trigger points, you'll have applied continuous force into the fascia in the area for 1 to 2 minutes. The decision on whether to do the foam roller technique or the lacrosse ball technique really depends on the intensity of the discomfort or pain that you're feeling. The lacrosse ball is going to be more pinpoint and more intense than the foam roller, and the PVC pipe is going to be more intense than the foam roller itself. The other limiting factor is going to be range of motion at the shoulder. If you have limited range of motion at the shoulder, it's going to be more difficult to use the lacrosse ball and move the lacrosse ball to where it needs to be.